That is something we need to address and discuss. Then, obviously, we are addressing the issue of medical supplies due to delays, and I can assure you that this is something that at headquarters, you will soon begin to see a lot of changes in that area. Also including the pricing. We want the prices of medical supplies to come down, some of them by local manufacturing, and then reduction of the amount of money charged from KEMSA. We want to ease the pressures that new and emerging diseases like COVID-19 pandemic has placed in our system. But I also want to urge our political leadership that please, we adhere to what we are saying here, because it is not enough that we tell the spiritual leadership, we have got other leaders in the country, we must also as politicians adhere to the rules just like everybody else, because then we will not be held responsible for what the aftermath that follows with the uncontrolled political gatherings. And in the same voice, I wish also to say to Kenyans that when we say that we bury people within 96 hours, it is because we appreciate the necessity of doing so as quickly as possible and with good reasons. And therefore, we are also telling the mortuaries around the country to ensure that that is what is done. That when bodies are brought into the mortuaries, we must bury them within the time that we have given. And this, so, my fellow Kenyans, I just want to once again reiterate that COVID-19 remains a big threat to us, and the only way we can overcome it is by adhering to the rules. But in this new phase of vaccinations, let me say that we want to encourage as many people as possible to take vaccines. On our part, we will make sure that we will have sufficient vaccines in the country. As the President spoke the other day and explained that we have already ordered 10 million doses of the Johnson & Johnson vaccine. And because of ordering the 10 million, we'll actually get 13 million doses of Johnson & Johnson in the country. And we are lucky because as early as in the next 10 days, we'll probably have the first batch here, and then the rest of it will follow as we go into next year, as we go into next month and the rest of the year up to next year. I also want to report that we will also be receiving a donation of 1.6 million doses of the Pfizer vaccine to fully vaccinate some 800,000 more Kenyans, and a further 500,000 donation of doses of Johnson & Johnson from the United States. And Johnson & Johnson, as you are aware, is a single shot. So when you say 10 million, then you get 10 million people vaccinated. And therefore, we on our part are going to do our bit to ensure that we get the vaccines. And I would like to assure you, even the people who took the first dose, I want to assure them that they will get the second dose and continue with the other people who did not get the first dose. The only way we are going to open our economy, the only way we are going to have people walking freely is by getting vaccinated. And therefore, we will put everything in our power, everything in our means to ensure that we get those donations and we get those ones that we have bought ourselves through either the AU facility or the COVAX facility. We'll also work with the county governments to scale up communication campaigns aimed at ensuring that more Kenyans turn up for vaccination, because there are those naysayers who will also pour cold water on the vaccination process, and there are those who fear, to be vaccinated. I've even seen somebody running very far away from a needle. So it's possible that is why your friend is telling you not to be vaccinated. Since you are not scared of a needle, you go and do it. Don't worry about it. And we can assure you that we are looking at vaccines that are properly checked and efficacious. So I just want to warn the county of Meru, because the owners of Meru are here, But I can say that as a philosophy and as a policy, it is important that we as a government are determined to A, train sufficient people in the country. Obviously, we do have a shortage of skilled personnel. And I think that one of the things that we are doing, and we want to do this in a very comprehensive manner, is to also discuss with the Ministry of Education. And we have initiated a discussion between us and the Ministry of Education so that there is a match between the training and the supply of the same. So there is a match between the requirements. We are the consumers of health workers. So we need to match what we are producing at the universities and medical training institutions and what is required on the ground. That match is what both CS Magoha and I have been discussing, and we want to address it holistically from the county governments, from the private hospitals, from more institutions, so that we can create that match. So as far as Meru is concerned, I think I'll let the Deputy Governor respond to that particular question. Over to you, my friend.
Thank you, Waziri. So I really want to thank you, Waziri, for the support that you're giving to this county. We're indeed very, very grateful. On COVID, we have so far been able to test of 6,200 patients. We have had active positive cases, about 2,400. And I'm happy to report, Waziri, that about 2,200 of those have been treated and been released to go home. Unfortunately, we have had 88 deaths so far, so we are still asking our people to continue, observing the protocols as guided by your ministry. But we really want to thank you for the support that we've gotten. We got support from the national government of about 152 million to fight COVID. Those funds have been properly used. The funds have been prudently managed, and I want to announce here that even when other counties and issues to do with the misuse of COVID funds, Meru County was cleared by the Senate because of prudent use of the funds that were allocated by the national government. Finally, Waziri, we've been able to vaccinate 25,600 patients, or rather not patients, sorry, 600 people with AstraZeneca, the first dose. We got the second dose, only 10,000 doses, and that has also, we have vaccinated 10,000 people. We are requesting, Waziri, I know you are doing a lot in that area, we are requesting if you are able to get more doses, because there is quite a bit of pressure from the people who got the first dose. So the balance of the about 15,000 or 16,000, there is quite a bit of pressure from those people who want the second dose, and of course also others who want to get new doses. With those few remarks, let me once again welcome you, Mheshimiwa.